name's Dave. I'm the founder and patient zero of Icarus Medical. I started this company because I had a knee injury when I was 15. I was playing football, dislocated my knee. That created a defect behind my kneecap in my cartilage, which progressed and started to wear to bone-on-bone arthritis in my 20s, which is about 30 to 40 years earlier than most people get knee arthritis. So I realized there were not many, if any, conservative ways to manage this type of knee arthritis that I have, which is patellofemoral knee arthritis, which affects about 80 to 90% of people who have knee arthritis. In my early 30s, I realized I pretty much needed a knee replacement. I had no cartilage left. There was no surgery that was going to be able to help my knee that was short of a partial or a full joint replacement. The problem with that is the younger you are, the more active you are, and the faster you wear out a replacement. Plus, there are many complications in a knee replacement. Around 20% of people who have it have problems or they're not happy with it. And it never feels right, typically. So I actually, in talking with my surgeon, he explained that if I lost weight, I might actually have a lot less pain in my knee because force is multiplied by about 3 to 5 times. Your body weight is actually multiplied by about 3 to 5 times in your knee. And so I started thinking about that. You know, I may not be able to lose very much weight, but if I could get a knee brace that actually springs you back up and takes weight off of your knee, I thought that might help me and allow me to stay active. I like skiing, snowboarding, wakeboarding, and these are things I really couldn't do. So I bought a knee brace off of eBay and put springs in it and made my own, assistance extension knee brace, and it actually worked really well. And I've been using this brace for years, and I did file a patent on it, unfortunately, but I had people asking me to make them knee braces, and every year I kept making a better one and a better one. And so I've been thinking about this for years, and then finally decided to build a company out of it. Once I realized how many people would benefit from this and how prevalent this condition is, and it didn't seem like anybody was looking to innovate in this space.